Thank you for joining us today. I'm Jim Williams, the chairman of the Pennsylvania Prostate Cancer Coalition. Together with our partners, the American Cancer Society, Action Network, and Zero, we gather here today to raise awareness about prostate cancer and to urge our lawmakers to assist us in improving access to early detection. I'm a 33-year survivor of prostate cancer. Thank you. Diagnosed in 1991, the disease was detected early and treated aggressively at a major medical center. And my military retired health care plan, TRICARE for Life, covered the cost. Instead of being the standard of care in the USA, I learned that my journey was the exception. Unfortunately, many cancer patients find some bumps in the road as they travel their cancer journey. We are here today to urge our legislators to assist us in removing one of those bumps, which is to eliminate the out-of-pocket expense for prostate cancer screening. Pennsylvania Prostate Cancer Coalition is a collaborative association of patients and survivors, their families, loved ones, friends, health professionals, caregivers, and community activists whose purpose is to make prostate cancer a critical public health care priority in Pennsylvania. We do this by disseminating information relating to prostate cancer, advocating for the highest quality of life for prostate cancer patients, performing outreach to involving all communities of the Commonwealth, and overall covering the cultural barriers and proper care and treatment of prostate cancer. I have the pleasure this morning of introducing you to several outstanding Americans who assist us in our mission. First, please greet one of our coalition board members, Jay Snyder, a Vietnam combat veteran, a prostate cancer survivor, former U.S. Tennis Open tournament director, and friend, who will tell us his story. Jay?
Like Jim, I'm a prostate cancer survivor, and most likely my prostate cancer began in Vietnam with my regular exposure to Agent Orange. It's been 17 years since I had a radical prostatectomy, and it's been about 19 years since I was diagnosed with prostate cancer. At that point, it was recommended that you wait and see how fast it grows, and in my case, it grew very quickly. But that diagnosis was the major step in my survival from prostate cancer. The most important thing, and the thing that I regularly go around talking about, and especially one-on-one with men, is getting tested. Set that baseline, and then if your PSA, your prostate-specific antigen, begins to increase, then you know that prostate cancer is not only in your present, but it's in your future, and you need to deal with it. But most men that die from prostate cancer die with prostate cancer, not from it, because it's a very slow-growing cancer. But it's a cancer that needs to be dealt with, treated, and resolved fairly quickly after you find out that you have indeed been tested positive for prostate cancer. That test you won't even know because it's part of a normal blood test. It's just a few extra dollars that get added on to the cost of your annual blood test when you have your annual physical exam. So there's no reason not to be tested other than the economic worry that people have that somehow it's going to cost them more than they expected. So Yes, prostate cancer is a killer. Yes, prostate cancer is something that we all need to deal with. Men, I had the very interesting experience. I did a morning radio show about 5 or 6 years ago, and the first question that the man it was his show, asked me was, how come we don't hear about women getting prostate cancer? Well, that shows the ignorance level of someone who's educated. I mean, he was a college graduate. You would think that you would know that prostate cancer is directed 100% at men, because women don't have a prostate. So that was one of the things that I realized there's a lot of education that's going to have to go on. So my voice joins those of Jim and all of our board members and all of our prostate cancer survivors that are part of the network in urging men to get tested, set that baseline, follow your prostate cancer journey as you get older, and with any luck, you're going to find out that you don't need treatment or an operation or something like that. But if you do need to get it, because you don't want to die from prostate cancer. Prostate cancer it's up there, it's out there. It's something that all men have to deal with, and I had to deal with it 17 years ago. I chose a prostatectomy. The recovery period was fairly quick. I was surprised, pleasantly surprised, actually. And I'm living proof now. Yesterday I was 82, so that prostate cancer journey has been long, but it was also very rewarding because I was able to have it treated. And then I became a disciple, an apostle, whatever you want to call it, of getting men to get tested. And anything that we can do to get our friends in the legislature to join us in that journey is wonderful. I couldn't help but have that feeling as I walked through the door. This is where I had my first job when I got out of the service. Right here in the Capitol, way up, one story above where the roof of the dome is here. But in any case, I worked here for a year plus, and then moved over to community affairs, which doesn't exist anymore. And my long 27-year career in state government before I moved on to my work that Jim mentioned in tennis. So I'm living proof that you get tested, you find out you've got the disease, you find out which of the options you're going to take, and then you go from there. So it's my pleasure to be here today. It's nice to be anywhere, actually. So thank you very much, and I look forward to answering questions too. So thank you, Jim.
Jay mentioned that he just had his 82nd birthday, Jay? Birthday? 82nd or 84th? Yeah, well, I turned 88 last month. Yeah. So Jay and I have discovered the first 80 years are the hardest. And then after that, it's a piece of cake. Yeah, yeah. Jay and I both were combat veterans of Vietnam, where unfortunately we had the duty of destroying property and people. Men die needlessly from prostate cancer today, and we're just trying to save a couple of lives. Next, we welcome Dr. Patrick T. Gamella, a urologist at Jefferson Health Systems in Philadelphia. He's come from Philadelphia this morning to speak to us and give us a health practitioner's perspective. Doctor?
Good morning. It's an honor to be here at the state capitol this morning. Thank you to the Pennsylvania Prostate Cancer Coalition, Zero, and the American Cancer Society's Cancer Action Network for allowing me to speak today, really about a topic that doesn't get the attention it deserves, but has a great impact on not only millions of men across the Commonwealth, but across the world as well. And that's the importance of prostate cancer screening and early detection. Prostate cancer is the most common non-skin cancer diagnosed in men across the United States. It affects 1 in 8 men in their lifetime. This means there's a chance that you, someone you know, or a family member will be touched by this disease. As been mentioned, while a lot of prostate cancer is slow growing, it can also be very aggressive, rapidly spreading beyond the prostate and becoming life-threatening. The challenge is also most prostate cancer is present without symptoms. For these reasons, early detection through screening is vitally important. I cannot stress this enough. Early detection can save lives from prostate cancer. As shown in the information sheets in your packet, the 5-year survival rate for a man diagnosed with prostate cancer is 100%. If you follow those men even longer, the vast majority of men do not die from their treated prostate cancer after 15 years. When cancer is detected early, treatment options are more widely available and less impactful on a man's life. Ensuring that all men have access, regardless of their ability to pay, to prostate cancer screening is vitally important. Numerous studies have shown that early detection through tests such as the PSA blood test can save lives. That's right. A simple blood test that only takes a few minutes can save a man's life. I had a recent patient in his 60s who, given not great access to health care because he worked numerous part-time jobs, had foregone any preventative care or screening for over a decade. At the encouragement of his wife, who was a nurse and had more consistent healthcare coverage through her job, he finally went to a doctor for the first time in about 15 years. After discussing screening, he did get a PSA test, and it was found to be over 100. For those of you not familiar with that, that's a very high number. You should be usually 3.5 to 4 or less in most men. After being referred to me, unfortunately, he was diagnosed with metastatic cancer. While treatable, cancer that spread to the lymph nodes and the bones is not curable. The one silver lining to this story is that his younger brother, who he himself had not received any screening up to this point as well, after hearing about what his brother had went through, had seen me to discuss screening, which I of course recommended. His PSA was mildly elevated, and after being worked up, he was diagnosed with a prostate cancer as well. However, it was a localized prostate cancer. After hearing his treatment options, he elected for surgery. He's now cured of his prostate cancer because he was diagnosed at a stage where that was possible. As this story highlights, despite advances in treatment and detection, many men are still not receiving regular cancer screenings. One of the barriers to this is the cost. For far too many men, especially those who are uninsured or underinsured, the cost of a simple PSA test is just out of reach. By ensuring all men in the Commonwealth have access to free PSA testing, we can not only save lives, but save long-term healthcare costs. By catching this cancer early, men can avoid more costly treatments down the line, reduce the burden on our healthcare system, and allow men to continue working, providing for their families, and being active members of their communities. As a society, we must do more to raise awareness of prostate cancer and the importance of screening for this disease. Too often, men avoid routine checkups and important conversations about their health care. Whether it's fear, misinformation, or just the general stigma that surrounds men's health issues, too many men are not getting the screenings that they deserve. To reduce these barriers, it's imperative we make screenings affordable and accessible to all men in Pennsylvania, particularly to those who are at increased risk. One of the most compelling reasons for this is health equity. As one example, not all men are equally affected by prostate cancer. Black men and men of African American descent are not only more likely to be diagnosed with prostate cancer, but when they are more than twice likely to have advanced disease or die from their disease. I want to close with this simple message. Prostate cancer screening can save lives. Early detection leads to better curative treatment outcomes and, in most men, survival. If you're a man over the age of 40 to 45, or you are a part of a high-risk group, those include men with a family history of prostate cancer or are Black or African ancestry, talk to your doctor about screening for you. And if you have a father, brother, or a friend in your life who are part of one of these groups, encourage them to do the same. A simple conversation can be the first step to preventing the devastating impact of prostate cancer. Let's all commit to making prostate cancer screening a priority, both for ourselves and for the men we care about. Together, we can make a difference, one screening at a time. Thank you.
Thank you, Doctor. The next two people who are going to speak to us this morning are special. I tell my friends, if you want to really see democracy in action, come stand here in the rotunda and see the various organizations who are here each day speaking their concerns. On many of those days, you will find Representative Pat Kim and Representative Justin Fleming here listening to these presentations and going into discussions on the various causes. As we all know, we're in the middle of a heated election season. Many things we hear and see are upsetting. However, as long as we have people like Representative Kim and Justin representing us in the legislature, democracy will prevail here in the Commonwealth and also in the United States will continue to thrive. So please greet my state representative for the 103rd District, Patty Kim.
Thank you, Jim Williams. And I want to commend Mr. Williams on his dedication and his advocacy over the years. He's the one who first taught me about what prostate cancer is. He shows up at senior health fairs. He has his big foamy finger out there educating folks. And he's told me some of the challenges. You know, he calls the guys knuckleheads. The knuckleheads don't listen. It's the women that we have to work. So on behalf of the women, let us encourage our significant others, the men in our lives, to get checked. So I come here very hopeful. Jay, my husband, also asked, why don't women have prostate cancer? I can't make fun of him because I married him, but it's out there. It's out there. And we do need more awareness. But my father-in-law is a survivor of prostate cancer, and a longtime employee in my office is a prostate cancer survivor. So I'm so hopeful that we can make changes and really save lives. I know that why I was invited here, because I am the chair of the Insurance Committee, and House Bill 531 is in my committee. I am a co-sponsor, Representative Fleming is a co-sponsor, and I assure you that my team is working very hard to make sure that this is a priority, that this bill is airtight so that we can pass it with flying colors through the House and the Senate. It's taking a little bit of time. We still need to talk to the consumers. We need to get the medical providers to buy in. So it's taking a little bit of time. I think Mr. Williams brought me up here to give me pressure to get it out of committee. We're working on that, we promise you, because we are passionate about saving lives and how important this bill can be to have insurance providers to pay for prostate screenings. So with that, should I take it over to Representative Fleming, or would you like to introduce him? Okay, thank you so much for being here, and let's save lives. Thank you.
Thank you. Justin, I just wanted to say thank you for coming this morning. And my recommendation and advice to you in your work is continue to do what you're doing. Thank you.
Thank you, Colonel. It's an honor to be here this morning with Colonel Williams and others. Jay. One of the things I wanted to mention, first of all, thank you both for your tremendous service to the United States of America. And this is where, policy is so important, right? The people who we elect is so important because in your remarks, Jay, you mentioned your service in Vietnam and encounters with Agent Orange and the prevalence. I think Colonel Williams mentioned as well the prevalence of individuals, contracting cancer from their service. We now have a federal law called the PACT Act that was really pushed by Senator Casey and others and signed into law by President Biden that allows veterans to get that look back and get those benefits that they've long been denied for decades. So that is now in place. And I was with Senator Casey at an event at one of the local, Post 1001, one of the local legions, when he was discussing the work and the fact that the PACT Act is now available. So this is really, really important. So for prostate screening and a number of other health issues, I encourage every veteran to look into the PACT Act and see if you would be eligible for those benefits. It's a pleasure, Colonel, to join you for the second year in a row to talk about an issue that affects many, many people. In President Biden's declaration of Prostate Cancer Awareness Month, 35,000 people die from this disease annually, and 35,000 men. And we heard from the doctor that this is eminently treatable. Eminently treatable. Think of that. We lose 35,000 people every year from something that is treatable if it's caught early. But as we've heard, why isn't it caught early? Some reservation, some fear among men about what's required to do the screening. The women in our lives, as Representative Kim said, could certainly help us allay those fears. I, for one, am on the cusp of 45, and I can't wait to get my first screening. Truly, because it's important to know. It's important to know these things. And I am standing here as a state representative, fortunate to have health insurance coverage, but I want to see that for everybody. I want to eliminate that financial barrier for everybody. So what is required for us to do that? Well, I believe what's required is, number one, working hard to get House Bill 531 out of committee that would require insurers to screen annually for men over a certain age and men at high risk, as we heard the doctor talk about. Those at risk who have prostate cancer run in their families, those men of African American or Hispanic descent, which prostate cancer, as I talked about last year, disproportionately affects those people a lot more. But I think dollars are also required. We heard the doctor talk about a barrier to getting those screenings, financial barriers. And think about this. We have many issues in our health system, in our healthcare system, but I always come back to this point. Context matters. And the context in which we live today is that America is the wealthiest nation in the history of civilization. And yet we still have men who are dying from preventable disease. And to me, that's unacceptable. So what we have to do in the Commonwealth is pass these laws, build this policy to improve the health and the lives of men, and adopt a state line item that will help men afford that screening. So they know if they need treatment. We heard from the doctor, early detection is key. We've got Colonel Williams as a shining example, someone who's a prostate cancer survivor for 3 decades now. Nearly as long as I've been alive, because I look so young. But it works. It works. We just have to have the will and the courage to put the policy in place to do this. So I'm committed to working with my friend Representative Kim as chair of the Insurance Committee to get Representative McNeil's bill out of committee, get it through the Senate, and get it into law where we can improve the lives of thousands of Pennsylvania men. Thank you so much for allowing me to be here today.
As Representative Fleming mentioned, more than 35,000 men will die of prostate cancer in the U.S. this year. We lost 50,000 men and 2 women in Vietnam in that 10-year war. We lose more men in the United States to prostate cancer in 2 years than the 10-year Vietnam War. One of our major problems is that men, we don't advocate for our health. Health policy in many cases is determined by noise, not really by the science. We look at the AIDS community and how that support system of survivors received enough research money to take AIDS from being a chronic, a deadly disease to now a chronic disease. I asked men when they took their car in to get the oil change, was the car sick? Why did you do that? And of course, we all understand preventive maintenance and the importance of it, how we save money and extend the life of those products that we perform good preventive maintenance. And it's the same way with preventive health. And we need in the United States to spend more of our effort in the prevention and the quality of health and give rewards to those who practice in medicine for keeping us healthy, not gaining more patients. Last but not least this morning is the Executive Deputy Secretary for the Pennsylvania Department of Health, Christine Rodak. The Department of Health has an outstanding Cancer Prevention Coalition program that we are members of. They support us in our efforts, and we'd like to hear a few words from the Department of Health. Christine, thank you.
Thank you, Colonel Williams, for your advocacy on this important issue. And thank you for the car analogy. I'm going to use that with some of the men in my life. I appreciate that. So good morning, everyone. I'm Kristen Rodak. I'm the Executive Deputy Secretary for the Pennsylvania Department of Health. I appreciate the opportunity to join all of you in raising awareness of prostate health, especially during National Prostate Cancer Awareness Month. Prostate cancer is a significant health concern across the nation and here in Pennsylvania. In fact, prostate cancer is the most common cancer among American men after skin cancers. In Pennsylvania, 1 in 9 men have a lifetime risk of developing prostate cancer. It is the #1 most diagnosed cancer among Pennsylvania males, and deaths due to prostate cancer are second only to lung cancer. We know that the risk of developing prostate cancer increases with age, particularly in men over 65. We also know that African American men are at a higher risk compared to men of other races. Additionally, having close relatives with prostate cancer significantly raises the likelihood of developing the disease. Despite its prevalence, many men have no symptoms, and the disease often goes undetected without screening. This underscores the importance of increasing awareness of the importance of screening. The American Cancer Society encourages men to make informed decisions about prostate cancer screening in consultation with their healthcare provider. This decision should be based on an understanding of the risk factors and benefits of screening. Please encourage the men in your life to talk to their doctor about prostate cancer screening starting at age 50. And depending on other factors like race and family history, men should be encouraged to discuss screening as early as age 40. The Pennsylvania Department of Health encourages all men at every age to engage in regular checkups with a healthcare provider. If you do not currently have a healthcare provider, or if you're uninsured, please reach out to your local health system or a federally qualified health center for assistance in obtaining a provider. Screening and early detection of prostate and other cancers can greatly improve survival rates and quality of life. Know your risk factors and family history, and share that information with your doctor so they can help determine when you should be screened for prostate cancer. We want to acknowledge and thank the Pennsylvania Prostate Cancer Coalition and Pennsylvania Cancer Coalition's Men's Health Work Group for highlighting this important topic and for providing valuable education and resources to the public. Please reach out to either of these groups for additional information or to get involved in promoting prostate cancer screening throughout Pennsylvania. Thank you again for the invitation and for highlighting this important issue.
Thank you, Kristen. Well, that's our presentation this morning. We have a table display behind you. Please go meet my executive director. Where's Christine Warner? Christine? There she is. My executive directors is also representatives here from the American Cancer Society and Zero. Pick up a piece of information, pass it on to a friend or a relative. You may save a life. Have a good day.